Hi, my name's Kathleen. I'm a registered nurse. I work at Monash Medical Centre and I've been in this role as the Scleroderma clinical nurse specialist for 11 years. It's a role I've come to thoroughly enjoy and feel really privileged to do. I think on a daily basis one of the biggest challenges for scleroderma patients is the loss of independence. So the loss of hand function, the loss of strength, the loss of dexterity, the inability to grip things and to achieve things. For a lot of people, the inability to work anymore or to work as much as they want to achieve as much as they want to around the home. If you can't contribute financially, then maybe you can do more at home, but if you're limited by strength and perhaps by shortness of breath, then it makes it a lot harder for you to contribute, and I think that must be devastating for patients. My role in the clinic at Monash is multifaceted. I think the primary part of the role is support, advice, education. I try really hard to make patients with a rare disease feel like they're important, like they matter. We're part of a large research database, so I do a lot of groundwork collecting data for the research and doing that as well as I can. I run a wound care service within the clinic. I work really hard at trying to reduce the number of times patients have to come to hospital, so coordinating tests with visits, streamlining access to healthcare. Negotiating the healthcare system is really, really hard, and I think with scleroderma it's relentless. You need to have screening every year, and that year rolls around really fast. We have a stall twice a year at Monash in June and November to raise money to support the nurse in the clinic. I think that we could definitely use more people to help with that. The few people who do help out are feeling quite overwhelmed each time it comes around. I think that having more people to man the phones for the patient support group to answer patients' questions and inform them about services and resources would be good. I think perhaps a higher presence of the patient support group at Monash Health would be useful. Although we're somewhat limited, we don't have any extra rooms in our clinic space. So I don't really know how we would facilitate that currently, but certainly I'd be happy to liaise with somebody on that basis, absolutely. That it would be helpful to have nurses in regional areas understand more about scleroderma, so whether that's through telehealth or whether they could visit Melbourne or we could visit them, because the numbers would be quite low to justify, a person such as myself, but certainly working with rheumatology nurses in regional areas could be good to, so they could provide the kind of supports out there that I'm doing here and patients don't have to travel. Currently my role is funded partly by patient fundraising, and the rest of it is funded by the Monash Rheumatology Department, so it's not a government funded role, and I think that it should be. I think that one day I'm going to leave this job and the next person coming into it may not want the job because there's no secured funding for the position, and I think that attracting someone into this role, I think that would be really important. I think it would be nice for the patients to know that it's seen as an important role that deserves ongoing funding. So the money that the patients fundraising provides supports about 1 day of my wage, and I work 3 days a week for scleroderma. So certainly I guess if we got a lot better at fundraising, but that's a lot of pressure to put back on patients. I still think that the funds that patients raise could go towards other things. If the government paid to have a nurse in the clinic, wouldn't that be good? They pay for diabetic nurses, they pay for cancer nurses, why not pay for a scleroderma nurse?